Bismillahirrahmanirrahim. Today we will discuss a case of a young boy who presented to us with severe shortness of breath, and there was no past history of asthma or COPD or any other illness that can cause the shortness of breath. When I examined this boy, there was decreased breath sound on the right side, and on this finding I advised the XHS review, and on XHS there was right-sided tension pneumothorax, and the primary treatment of the pneumothorax is thoracotomy, and we referred this patient to the tertiary care for thoracotomy, and there he was admitted. Thoracotomy was done, and there was the expansion of the lung, and he was discharged with normal chest x-ray and without residual sign and symptom of the pneumothorax. So the take home message is, when you are interacting with any person who has previous illness regarding respiratory system or new onset of the symptoms that are related to the respiratory system, so you have to take the history in detail, and followed by your careful clinical examination, and the primary investigation you will advise is the X-ray chest to rule out the pneumothorax. Or even then, if you start your treatment on your provisional diagnosis of severe asthma or COPD and the patient is not getting improved, then again you have to advise the XHS to rule out the pneumothorax, because pneumothorax can be the primary or the secondary, and in this patient his pneumothorax was primary because there was no any illness that can predispose the pneumothorax. And the most common illnesses which can lead to the pneumothorax in our community are UPD and bronchial asthma, and there can be traumatic pneumothorax as well that you will rule out from the detailed careful history and clinical examination. Thank you.